Breast cancer is one of the leading types of cancer diagnosed in women in Africa. According to Glob 2022, Africa showed different mortality and incidence across the continent. Breast cancer, incidence and mortality. Mortality is affected by late diagnosis, inadequate health infrastructure, and limited treatments. Breast cancer in Africa is mainly distributed into luminal, 56.3%, HER2 positive, 12.61%, and triple negative, 28.1% subtypes. The triple negative subtype is associated with African ancestry and is more aggressive, with a higher mortality rate. Also, this ancestry affects the epidemiology of breast cancer in countries involved by the African diaspora due to the slave trade. Brazil was the country in the Americas that received the most Africans, 38 million. North Africa has a higher incidence of the luminal subtype, 63.42%, while in West Africa, this value is much lower, 41.04%, with a higher prevalence of the most aggressive subtypes. Taking into account the most aggressive subtypes, Ghana has the most worrying rates, triple negative frequency of 57.2%. Disparities in diagnosis and treatment attributed to variability in methods of assessing recipients. In addition to the lack of input for HER2 testing, such as the paucity of in situ hybridization methods, highlight a worrying epidemiology. The research highlights the need for standardization in diagnosis and early interventions due to the high mortality and advanced stage at which cancer is usually diagnosed.